Hey, what's up? This is Ian, and in this video I'm going to talk about BPC 157 and my experience with it. This is what it looks like when you add water to it. It looks like water. It's clear. And what does it look like before you add water to it? It's kind of weird. They call it a lyophilized powder or something like that. And you see that? So, anyways, that's what it looks like. And so why did I do it? I tore my meniscus December 8th, something like that. And I was looking into surgery and thinking all these things and PRP. And I asked a question about, in Reddit forum, about should I do PRP or has anybody done PRP or had a partial meniscectomy or stitched meniscus, and got a bunch of answers. Someone mentioned BPC 157, and at that time it didn't sink in. I didn't do any research, and I just kept digging, researching, thinking about what I was gonna do and stuff. And it came up again, and I also had it in my mind I was gonna try like DIY PRP. So I ordered some needles. This is a 1-inch needle. And I'm in Japan. You can't buy needles in like a store or whatever. So I had to order them online, and I ordered them. Anyway, so BPC 157. The first injection I did was on the 24th. So BPC 157 has like a short half-life. Like from what I understand, I'm just telling you what I've learned and stuff. It's like around, I've heard anywhere from 4 to 6 hours. So that means like it's not going to be active in your system very long. You take it, you can eat it. Recently I started to, instead of injecting, I started to, actually I squirt it into my mouth, into my gums. I had a gum that's really receding bad. But anyways, so the 24th was the first time I injected it. And I did that. I did injections about 3 times a day for probably 2 weeks. And then the last few times I did injections, I think the needle was getting dull. Like usually I would use 1 needle per day, but I would do injections like 3 times a day, and sometimes 2 spots at one time. So, and I would clean the needle and whatnot. But the last few times I did it, like, I don't know, I kind of left some sort of bruising and painful lumps on the skin, but it's going away. It's okay. So I don't know if the needle was too dull and I irritated my whatever. Anyway, so how I did it, it was for my knee, was my main thing, but I got other aches and pains and stuff. My shoulder, I got I don't know, I heard that 3 months ago, and I think is in the past, when I was like 20 years ago, I like tore my rotator cuff. But I also did some injections on this. I find the best way to do it, like I can't really do it quite here, but is to put your arm like on a counter. Imagine there's a counter here like this, and that's gonna, like, it's not relaxed now because there's no counter here, but that's gonna relax the muscle here. And this is for me, for my case, like I think actually it was I might have like torn a muscle in my deltoid or something like that. So what felt the best was actually doing a straight injection, intramuscular injection. You can look it up how to do it, which is basically straight. And I would go the whole inch of the way in too. Sometimes I did like under the skin injections. They call it subcutaneous injection. And was it John? Person who I recommend to look up is Jean-Francois Tremblay. He's got a lot of great, really good videos, informative videos about peptides and stuff. You can look up. He's going to tell you that it doesn't matter. It usually doesn't matter where you inject. And there's some information out there. People say to inject by the injury and stuff. His he said is basically, well, if you inject by the injury, it's going to get absorbed by your bloodstream. And he says it doesn't matter. And that'll the peptide will find its way to the injury. However, if you have like, my main thing was my knee, my meniscus, on the inside of my knee. So sometimes I did. Now, before I did this, I actually injected blood into my knee, my own blood. I took my own blood out and I injected blood into my knee. I can't quite show you, but basically I sat my knee down like this, and sometimes I would go, here, I'll show you my hair. I would go, there's a point, you look this up, don't take my word for it and go do it, but look up knee injections. There's different ones like cortisone and what's it called, hyaluronic acid and PRP injections. You can learn a lot about knee injections, and yeah, I don't know. So you get like a little pocket in your knee where you can go in. There's a space, and because if you inject, it's more efficient because your knee capsule is protected. Like if there's no blood in your knee capsule, right? So if you know the whole meniscus talk, it's like it's not going to heal. If your tear is on the inner part, the inner 2/3 of your meniscus, the orthopedic surgeon is going to say it's not going to heal because there's no blood flow. Look, I did a lot of research on this, and I'm definitely no expert at all, but what I've learned is, well, one, you do have blood cells in your meniscus, and two, why not just inject blood into it? So that's what my thinking. My first injection I did was actually just my own blood into my knee, and I went in through, actually the first time I went through probably this side. But yeah, basically you want to go in, and you get a pocket on either side, a little space where you can go in that's above the meniscus. You gotta look it up. I can't really. Another video I made, I kind of drew. What video was that? Yeah, there was another video I made anyways recently. I'll put it in the description below. But anyway, so I injected 3 times a day. I didn't always go in though. This is the best, I think, for if you have like something like a meniscus tear or something like that. And the best way to do it, of course, would be have a professional do it and not try it yourself, because it's maybe a little risky, because you could go into your meniscus, or you could hit bone, or you could, I don't know, you could hurt yourself. I don't know, a lot of things. But I don't know, I just did my research and I want to try it because I knew that would be the best thing to do. So I didn't do that every day though. I did that maybe probably twice a week or so in the beginning. The first few days I might have did it the first 3 days, if I remember right, in there. But you don't have a lot of space here. There's not a lot of space to go in, and you don't want to keep puncturing the same spot over and over again, so you have to slightly move it. So yeah, actually another peptide I think would be better. I ordered that too, called TB500, because it has a longer life. Like BP157 has a short lifespan, so that's why you have to inject it often, only 6 hours. But something like TB500, thymosin beta 4 has like a I don't know, like around maybe a week half-life. So for a knee injection, I think that would make more sense, because you don't have to keep injecting into your knee capsule. But sometimes I didn't always do that. Sometimes I would inject like over here near my MCL ligaments, or I would like maybe pull up the skin a little bit and then go in. I mean, it's your knee, so you got to be careful about it. Sometimes I would go in the muscle back here. My tear in my meniscus is back in here, the doctor said. So yeah, so I injected pretty much around here, maybe for a few weeks. 2 times a week I'd go here. I mentioned I did one blood injection before I did this, and then just recently I did a 3rd blood injection with BPC. I made a video about that, and I show where I marked off the spots, so you don't. So that's all right. So probably we want to know, does it work? Okay, so for 6 weeks, I was walking around in pain. Not always in the daytime. My leg definitely favoring my left for a long time. I definitely favored my left leg for a long time, and for 6 weeks, I had pain. And it wasn't long after I started to use this that I've noticed my pains decreased. So now it's February 11th. I started using this on January 24th. And now I feel like my leg is, so what's that? That's like maybe close to 3 weeks. That's like close to 3 weeks. So my leg feels stronger, I would say. Less pain. For 6 weeks, by like 3 or 4 o'clock, I'd pain. I wouldn't want to be standing up for long, and I'd want to sit down. So usually in the morning, daytime, it didn't bother me too much, but yeah, it's definitely feeling more stable and strong. Now, it's not like super quick. It's not like, and I was doing this 3 times a day, probably roughly about dose range. I would say anywhere from 500 to 1,000 micrograms a day. What's that? So, and I'm translating this to milliliters because usually I would inject. Can you see that? So that's about, right now it's like 1 milliliter. So that'd be about 1,000. So often I was doing about injecting that much total in a day. So it's not really that much fluid. And so sometimes maybe a little less, like that much total in a day. So maybe in 3 injections, like 1 injection, maybe around there or so, but not super mathematic. I never noticed any side effects or anything. The first time I did this, I felt a little anxiety. I think because you're like, I'm injecting this into my body, so for maybe a moment after I did the injection, I felt a little anxiety. Sometimes I felt burning. I remember the first couple, I felt like a little bit of burning. It could have been because a few different reasons. One could have been the first. I made my own bacteriostatic water. I used, which is like 1% alcohol and 99% water. Supposed to be sterile water. I used boiled tap water at the time and 1% ethanol. They say benzyl alcohol you're supposed to use. I couldn't find any benzyl alcohol where I am, so I got ethanol. I used that. I don't know. I looked it up. It didn't seem like, I saw some information about actually ethanol and knee injections for something, so I was like, that's probably all right. So, anyways, I felt a little burning a few times. Most of the time, no, I never felt any side effects. I haven't noticed how it's affected me really at all. I just feel like, yeah, okay, the pain's gone down. Like my leg feels is feeling stronger. One time, immediately, my left, this one was hurting one morning because I think it's been compensating for the right one so much. But actually, originally, this was the weaker knee. This one, a long time ago, I tore my MCL, and I have some patella tracking. I think the muscles in my right leg, I don't know, get some funky thing going on. Anyways, I felt pain in the morning with this. I did 2 injections. I did 1 in this knee and 1 in this knee. When I say in, I think inside the knee, not like outside. And they say if you're gonna try that, you need like at least a 1 inch or 1.5 inches. Do that. But anyways, I'm not recommending that. Just saying. And almost like in the first 30 minutes, I felt kind of burning in that knee after the injection. But then after that, pain was gone, just like that. So there's been a few incidents with my shoulder. I haven't seen it. To be honest with you, I don't know if it might help a little bit, but not a little bit less obvious than my knee. Now also I've injected blood in my knee 2 times, so that probably helping too, but I think like a blood or PRP from what I understand is a peptide is probably gonna be offer you faster relief. So anyways, I think that's all I have to say. I just want to share my experience because I was looking for, information and on YouTube and stuff and listen to people's experiences, searching Reddit too. So I thought I'd just like chime in and share my 2 cents. I'm gonna continue using this until probably I'm gonna continue using it until I ordered some other stuff, another peptide, TB500, but the real TB500. It's called LKKTETQ, which is like it's 7 fragments. Like thymosin beta 4 is like 43 amino acids, but the real TB500 is only 7 amino acids, and so I ordered that, and I'm going to use that on my knee and some other stuff, other areas, and see how that works. And another one called GHK, there's only a 3 amino acid peptide. Anyways, so we'll see how those work, and that's it. So this is Ian. Have a good one. Bye-bye.